reports by web and by email, but we really wanted the SMS gateway to interact with the general population. So I reached out to frontline users and put out a tweet, of all things, that I was looking for someone to help us set up a gateway. And crazily enough, someone in Cameroon who was following me put me in touch with the IP manager from Digicel on the ground in Haiti. 10 minutes later, we were Skyping, and in collaboration with Katie Stanton and Katie Dowd from the State Department, we secured a shortcode, 4636, that we could essentially use to provide a free service for people to text in. We pulled together about 10 different organizations across 3 continents into a Skype chat because email was just too slow. And we were really charged with creating a system that could take a flood of text messages, process them in near real time, and get them out to people in need. So we were lucky enough to link in with Tim Large and the Instead team. So Tim is with the Thomson Reuters Foundation, and they basically went radio station to radio station and put out the word that people could text in their need and their location to 4636. And really, this is where we started. This is the first introduction of the system to the public, and we had to adopt a very particular ethos. I chose a quote from World War II. The difficult we do now, the impossible takes a little longer. And I'm going to turn it over to Rob to explain what was built.
Thank you, Josh. Hi, everybody. My name is Rob Munro. I'm a computational linguist, and for about a year now I've been specializing in methods for processing large volumes of SMS in a multilingual context. And this became very important in the wake of the earthquake, as you can imagine, with the system that Josh just spoke of. So the immediate problem, of course, was that once text messages started coming in, the responders do not speak Creole. For most people in this room, the responders would understand these messages about as well as you can. They would not recognize the language for a start or the locations. And so we needed to create a system that allowed people in real time to translate all these messages. So as you can see here, people needing food and water, reports about supplies, medical supplies, or even just childbirth. We received to date about 40,000 messages, and we estimate that about as many people have had the first food or aid delivered to them as a result of a message that has come through the system. And so what that means is if you came online from anywhere in the world to translate these messages, on average, for every single message that you translated, you helped one person in real time. And this is a map from the IP addresses of the first week of all the volunteer Creole speakers who came online to translate these messages as they came in. We launched this online system that allowed people to make these translations in less than 48 hours. And the average turnaround time of having a message coming in to it being translated, geolocated, and back to responders was 10 minutes. And that picture you just missed was Brian Herbert of Haiti. And he was absolutely the star developer in making this happen. So the process has 2 steps. The messages were translated, categorized, and geolocated, and I was coordinating the workers at this step. In the second step, the locations were refined by crisis mappers, and in collaboration with the responders, actionable items are identified. And it was Roz who was coordinating this step with Haiti. Instead, who are joining us on the panel, among many other functions, ensured that we had reliable delivery of these messages for a large number of them. Our primary responders were the American military. And needless to say, this is why we needed the translations in English. So this is typical. Not only do the responders not know Haiti, but they not know Creole, but they also did not know Haiti. So in this case, a message came in saying that there was an emergency in Thomason. Delilah read this message. She's in San Francisco. Apple, who is in Montreal, knew the location. So in the chat room, Apple is like, it's at this location, it's on Google Maps, we have no street names. So he was able to simply click on this place where he knew this location to be, even though it wasn't labeled, and have it generate the coordinates. And the feedback we got from the responders, actually I believe it was Roz who wrote this to me, was that in this particular case, the GPS coordinates were 100% accurate. And so he was able to apply his local knowledge, and within 20 minutes, in this case, a helicopter with medics was dispatched to deliver this child safely. And as I've said, I know this place like my pocket, and Delilah said, thank God you were here. For the connected generation, it was always our promise that we could make a difference in real time anywhere in the world. And it was with great sadness and humility that we learned this was true during the Haiti crisis response. Apo is Fred Michel. His sister was killed immediately in the earthquake. She was a bank manager in Port-au-Prince, and his mother was left homeless, and it took a week before she was able to join him safely in Montreal. And a lot of the feedback we've got from the more than 1,000 volunteer translators who came on at different times to help was that it was so important for them that they were able to make a difference in real time. They simply couldn't donate and let that be enough. And beyond simply translating these messages, from about day 5, they had very reliable communications within Haiti. So they were replying to individual messages, coordinating with people on the ground who they knew, and then collaborating on the Ushahidi mapping service. So if a message would come in and someone was looking for supplies but it wasn't an emergency, they could get in contact with this person, interact with the map, and direct them to the nearest aid center, explain to them the processes for how you get the coupons, etc. It also became immediately obvious to us that we needed like a really long-term sustainable microtasking platform. So early on, I met with Lucas Bewald, the CEO of Crowdflower, and he agreed to host a service for free. In this meeting, we found out that Summersource had been training people in microtasking before the earthquake and actually signed a contract just 20 minutes before the earthquake hit. But Josh will tell you more about that a little bit later on. And beyond this, we're preparing for elsewhere. So one of our most dedicated volunteers actually lives in Istanbul, and this was a trial run using Twitter and obviously words like party rather than earthquake and the Ushahidi mapping system, so that they could have this system up and running and ready to go if ever the worst happened there. And for me at least, most of the technology we used, it's been around for 10 years. We're very familiar with it. And it's the people who really made the difference here. We just made a place for them to come online and do amazing things.
Hi, my name is Raz Sewell, and I'm the Director for Crisis Mapping at the Ushahidi Haiti project at Tufts University. And I'm here to talk about the crisis mapping response and how we mobilized our network behind mapping the text messages. So this is a picture of our sit room. We mobilized just 2 hours after the earthquake. Patrick Meyer got on the phone with the Ushahidi dev team and said, okay, there's been this massive earthquake, poorest country in the Western Hemisphere, we need to do something. We also had students from the Fletcher School of Law and Diplomacy on the ground, so we had a personal connection. So essentially, what did? They started setting up this whole workflow. Patrick reached out to his networks and said, hey, come, if you're in Boston, start crisis mapping. He set up a series of Google Docs while the Ushahidi team was setting up the actual platform. So that within about 5 hours after the earthquake, this is what the platform looked like. They were sparsely populated, more reports were coming in, but we'd mobilized so quickly that we were catching things essentially right after it had come off the ground. And our initial sort of sources of information were Twitter, Facebook, various different social media websites. That's what we were initially pulling, and we would document every source that we could find on the web that was saying something about Haiti, and we would monitor those probably about 20 hours in the day. So that 2 days after the earthquake, we'd become this sort of pseudo-situation room in Patrick's living room. We'd all come around. We were sitting, monitoring these sources on our computers, eating pizza, just trying to collaborate around this effort. And then we started to streamline our workflow. We had someone monitoring sources, someone taking that information, putting it onto a Google Doc, then someone taking that Google Doc and making that into an Ushahidi report. So we had this sort of forward system of dividing effort. So that about 5 days after the earthquake, when we really started getting into the text messaging system, we already had a series of reports, so that now the website had to be clustered as opposed to just point-specific data. And so as Robin mentioned, where we sort of fit into this workflow was we were the link to responders. We were working primarily with the US Coast Guard and the US Marine Corps, so that we were taking the messages, finding accurate references for them, and then relaying that to them either via Skype or just also using Ushahidi reports. Well, a week after the earthquake, messages really started coming in. We were getting about 1,000 a day, so we had to scale up. We ended up having a series of trainings at Tufts University and had over 150 volunteers come out and try and map this effort. And so for us, processing a text message looks like this. All the messages were grouped by phone number, and you can see both the Creole and the English, and then you can create a report from that. So that's how we sort of read through the messages and created Ushahidi reports. So 10 days after the earthquake, we would get really excited when we could find a location on a map. We didn't have, the knowledge that Haitians do, but we started to get to know Haiti and Port-au-Prince really well. But in all seriousness, we really came together as a network of people, and this was sort of our result. We took crisis mapping tools and a network of students and professionals and brought together this sort of real-time or neo-real-time platform that was a link between the people on the ground and the people with the capacity to respond. So 2 weeks after the earthquake, we're still going strong. But we have a workflow going, and we start setting up this entire massive project around the effort. We created a wiki, an organizational structure. Granted, we've gone through about 7 organizational structures, but that's okay. And we started reaching out even further to our networks. We set up situation rooms in Portland, Oregon, London, Geneva, Washington, D.C. to do the same effort. And we even reached out to the folks at Crisis Camp to further develop the platform and continue to move forward in this process. So one of the platforms we are now working on is this ticket tracking system so that we could take the messages and farm them out even further so that we could have this now 300-person volunteer base working on processing all of these messages at once. 3 weeks after the earthquake, things calmed down a little bit. Instead of 150 to 200 reports a day, we're now doing about 50 reports a day, so we can kind of calm down. Our situation rooms sort of closed a little bit, and we started working on customizing the platform. We actually had a field representative in Haiti starting in February, and he was getting information from responders as to what would be more useful. And what would be useful for them is getting reports, not just by location, but by category as well. And then also, we started working with a tech company called Solutions and the new 177 shortcode, so that their platform, NULA.ht, can be for 177 what Ushahidi was for 4636. And I actually want to close with a story. These 2 women texted into 4636, said they need medical help in Grand Goave. Through our whole system, we were able to map that message, and then a Marine Expeditionary Unit was able to go to Grand Goave and medevac them to safety. And that's why I love my job.
So just to close out, it's a great story. So basically, as you heard from Roz and from Rob, we received a flood of text messages when we opened the gates. And a lot of them originally were search and rescue requests. And we have stories of people who were literally pulled from rubble because they or bystanders texted in. We also have cases where we had a camp, an IDP camp of about 2,500 people. And we received a couple hundred messages saying that they urgently needed food and water. And after a quick survey by aid organizations, they reallocated their distribution efforts to include that camp. We also had very personal stories. You heard one. There's also a woman who was bleeding out during labor, and she texted in. 10 minutes later, the U.S. Coast Guard was responding with the latitude and longitude. We also had hospitals who were telling us that they actually needed patients. So one hospital had 200 extra beds. They had excess capacity. So we put out through a radio announcement to direct patients there instead of other hospitals. We also had a clinic that needed, sort of urgently needed diesel fuel to keep their generator running. And so we really saw a broad range of requests. And at the outset, they were urgent needs. They were search and rescue, missing persons reports, and that shifted quite dramatically in about a week and a half to food and water needs and access to health services. And Rob mentioned that there were 40,000 useful text messages that came through, about 80,000 total in the first 6 weeks. And at the peak hours, the messages that needed to be escalated and acted upon took between 2 and 5 minutes for us to process end to end. But we really wanted a local and scalable solution, and we wanted it to be run by Haitians. So luckily, we found Lila Jana's group, Samasource. They're based out of San Francisco, and they basically provide digital micro work to women, youth, and refugees around the world. They linked up with 1,000 Jobs Haiti, just outside Port-au-Prince, to basically employ people and deliver this digital work. And translation services and this geotagging and categorization, they were perfect. So we worked within the Crowdflower platform, and we're now employing about 100 people in Mirbelet, just outside Port-au-Prince, to do that first step. So it really is a system that is run by Haitians and for Haitians. So that's the 4636 story. And to me, the takeaway is that we can make the technology do what we want. It's really about getting the right people into the room or the Skype chat, and for those people to have the will to act. Thanks very much.
So I'm going to sit up there, and we'll go to the presentation. Please.
You've all heard their stories. They are amazing and riveting. So please, the floor is yours.
Good morning. My name is Helen Manich, and having been in Haiti, I certainly applaud everything you've accomplished. And I'd like to perhaps take your thread and pull it in two other directions. The first is Mayor Jassan's team in Port-au-Prince really needs access to the GIS mapping that you have done, or I'm currently also working with the Architects for Humanity that put it together, but they had all of their IT infrastructure and their GIS mapping by streets destroyed. So if there is a way for us to team together between what you've put together, and we're also working with the Architects for Humanity, to get that into an object database so that the mayor's team can start planning things, I think that could be a next step of use of what you've developed here. That is a very pressing need. The other is we've also been working with the chief of the National Police, and they could also use both how you're using for connectivity and the mapping of this. Their entire command center was destroyed, and I'm very certain that while some of the officers may be aware at the tent cities and so forth of what you're doing, I'm fairly certain that the Chief of Police, Mario Andorsal, does not. And I would see that what you've done here could be extremely helpful to the police in the short run, as well as to the mayor. And so I'll touch base with you guys afterwards, but those are two pressing needs. And since you've already done this, love to use those resources in these two additional ways.
And folks, while we're doing that, just there are two fixed microphones on either side, so if you do have questions, please feel free to use those as well.
So I'll respond very quickly. I think that one of the major success stories in crisis technology was what happened to OpenStreetMaps. And if just check out videos on YouTube, you'll see how it changed in a matter of days. And it's very outstanding. So it's become a terrific resource with amazing granularity. So I would recommend that. Absolutely. And second, we were lucky enough to meet with the Haitian National Police when we were in Port-au-Prince at the end of February. And they're very interested in figuring out how to integrate SMS and this mapping into the 114 short code for fire and security. So it's on the table, and we're optimistic.
Just to add something quickly, in case it wasn't completely clear in our presentation, the Ushahidi maps are already online and available. So certainly the mayor's office would be able to access them. They can add reports if they like and interact with them however they choose. That's a good question. I'm actually going to turn this over to Roz, who knows more about this than me.
Actually, for the 4636 text messages, you go to haiti.ushahidi.com. But for 177, which is the new short code that transitioned from 4636 to 177, is actually nula.ht. So that's NOULA.ht. And that's run by a Haitian tech company, and we're doing some tech support for them. Yes.
Anyone else? You guys are not shy. Let me start off with one. What were some of the key challenges that you guys faced as you ramped up to deploy the system? And I'm asking this because as we look at ways to keep this as a long-term sustainable system, those lessons learned will be beneficial for those who will take this over.
I'll comment very quickly that there was just an enormous amount of responsibility. So when you publish this service, anyone who texts in, you owe a lot to them, and you owe it to them to do the best you can with every message. And so we didn't feel we had all the proper redundancies in place. We were basically staying up 24 hours a day, making sure we didn't lose a single message. And I think given some time to prepare, we could build that into the system.
One thing, hi everyone, my name is Luke Beckman, I work for Instead. One thing that we need for future operations, and one thing that we saw very quickly, was this was an ecosystem that sort of evolved and emerged out of thin air. And it was based almost entirely on personal relationships and trust. So it was who knows who can find who, Who can you text? Who can you Skype? Who can you tweet? And so these kinds of relationships are crucial. And we had the kind of response that we had, I think, partially because of the proximity and familiarity. Haiti to the United States, and if that happens somewhere else, do we have that kind of diaspora in the United States or in whatever other countries trying to mobilize this kind of response? And one of the other big things would be learning from Haiti and also from every other operation that this kind of thing happens with is how do we get the feedback from the ground as to what worked and what didn't? We instead worked very closely with Thomson Reuters Foundation, the Emergency Information Service, and the AlertNet team. And I believe Ushahidis started doing this as well, but getting that feedback from people on the ground who were recipients of information, they heard the radio broadcast and they said this was useful, this wasn't useful. Getting the feedback from responders. For example, I know of search and rescue teams because we are connected closely to them. Some went to incorrect locations, some went to correct locations. We had saves, but with a lot of the dispatches, with a lot of needs, we don't really know at this point whether it was good information, bad information, timely enough, was it too slow, can we do better, was there a team that was 2 minutes away and we had to dispatch a team that was 4 hours away. We know that happened on several occasions. So there are things that we know we can do better. And I think it's our responsibility, if we're going to do this kind of thing, it's our responsibility to get that kind of information.
Hi, my name is Chris Roller. I'm from Johns Hopkins University's K for Health project. And I'm wondering, there's a lot of great mobile initiatives in Haiti and around the world. I'm just wondering how we're bringing the experiences together so that we could learn from the successes in the States. In other words, where do you see knowledge management playing a role in these type of initiatives and campaigns?
The Ushahidi at Tufts team, actually, one of our big concerns is knowledge management. So we're actually launching an evaluation of our project that we're going to make available as soon as it's done. So that's one way we're trying to make sure that everybody that's doing research on this, that's really evaluating this project, that information is readily available on our website and to the wider audience. So that's one way that we're really concerned about it.
Another question here?
Good morning. My name is René Aubourg. I am an assistant professor of public policy at American University, and I'm also the director of international program at American University. I would like to make an introduction today, not as American University, but as the co-owner of Solutions Haiti. And my family co-owns Solutions Haiti, and I would like to mention quickly what they have been doing since the earthquake. One of the things that Solution have put in place, and this was already before the earthquake, is what is called the MESSI site. It's Monitoring, Evaluation, Surveillance Interface website, and it's for the CDC. And it's tracking all of the transmittable disease from mother to children throughout the territory and using GIS. And basically, including also HIV. So they have been monitoring that site. You can go to www.messi.ht to know what it is all about. But the other thing also is that they have developed and funded, and this is with our own finances, the platform called NULA, which is www.nula.ht in Haiti, which is basically a platform that has 6 functions: critical places management, effort and distribution tracking, program monitoring and evaluation, resource dashboard, population tracking, and finally, they have put in place a call center which is called 177 call center and messages. Basically, it has to do with public health. And I think some of my colleagues at Solution have met some of your panelists here. The other thing is that they have been very involved also with the transfer houses, specifically Unitransfer and also CAMS in Haiti. And basically, they have collaborated with, for example, Unitransfer, which is one of the main remittance companies in Haiti, to provide SMS alert to people receiving money from Cash for Work and from cash donation, operated by the the Red Cross in Haiti. And this is something that has been quite effective. They also do what is called general and active health surveillance using mobile tools. In fact, with the support of an organization called PEPFAR, They have developed, after the earthquake, different mobile data collection tools for the Epidemiological Bureau of the Ministry of Public Health. And basically, these tools daily aggregate reports on critical pathologies that are happening in the camps that are built throughout Haiti, these makeshift camps. And these makeshift also health facilities. So that's what I just wanted to say. Thank you.
Any comments from the panel? Let's go to the next question, please.
I'm Mary Blocker from the State Department, and I work on Afghanistan, and we're trying to set up big SMS project in Afghanistan. So I'm curious on three things. One, as I hear you speak, it seems like a couple of you stood up that day and decided to do this. It's fantastic. How did you get the authorities, like the Coast Guard and so forth, to recognize you as the people to go to for the help? Another thing, Frontline. Is there a limit on Frontline's capacity per minute to use messages? In other words, it can only handle so many messages a minute. And what interaction did you have to have with the local wireless carriers to make this happen? So those are my three questions. How you got to be the authority, how much Frontline can handle, and interaction with wireless carriers. Thank you.
I'll take part one. So finding the authorities, and then how do you do this, and how do you work in the environment? Personal relationships. A lot of times it was one person in an organization, and our first link to state was Katie, really, and kind of finding the people who are the thought leaders or those who are willing to engage with this kind of material, this kind of infrastructure. And then it was a lot of this. There was no authority in terms of this is 4636 and this is how it's going to be. It was, if the information's wrong, people stop using it. If it's right, and if it's timely, and if it's better than what people on the ground have, then they'll use it. And that was how the ecosystem evolved, I think.
It's a spot on. Regarding second question, we haven't hit a limit for processing incoming messages for Frontline, but we actually didn't use Frontline SMS for this particular system. We tied in straight to Digicel's and Voila servers, thanks to help from Ed and the team at Instead, and the engineers on the ground in Haiti at both those telcos. So that link to the wireless carriers, in this case, we were able to establish very quickly and move fast.
What is Digicel?
Digicel is the major provider in Haiti. They have about 70% market share.
Yeah, so I'd say that the biggest bottleneck was not the technology in terms of the volume, but the manual work required. So with the translations, we needed to translate every single message. Excuse me. And even those that weren't emergencies, we needed to translate because it wasn't the role of the volunteer translators to decide what's actionable and what's not. And so we really did have to find as many translators as possible. And we have social media to thank for that. So the main place with which we found the translators was Facebook. So I went to every Facebook group which had Haiti or Creole in the name. I went to every open Skype chat with Haiti and Creole in the name and basically spammed them. In fact, it was spam. So Facebook were about to ban us for being spam because we cross-posted so quickly. And we had to contact them and say, please do not. And they changed their filter settings so that anything with 4636 in it would not be spam. And yeah, it really was engage in that workforce and to get that as big as possible was to alleviate what would have been the worst bottleneck. And that's something that will remain going forward. The technology you can get in place in advance of a crisis, it's a lot more difficult to know what kind of work you're going to need, like who you need to do the translations or the mapping.
Yes, my name is Matthew Lewis. I flew to Dominican Republic 3 days after the earthquake and traveled to Haiti from Dominican Republic. With just an iPhone, I GPS located about 200 orphanages and went to Salvation Army and went to the UN and talked to them and pretty much kind of begged them for scraps and fed all these people over a 4-week period. But the number one issue for me was that I had a hard time dealing with was the fact that I couldn't go to the Haitian government for anything. It's just I had to go to the 82nd Airborne, the UN, the Salvation Army. What are you doing specifically to empower the Haitian government to respond for themselves? Haitians helping Haitians. What are you doing? I mean, what's the strategy to get the Haitian government involved in this?
Sure, yeah.
Well, that's the sort of impetus behind the 177 system. We're trying to work directly with the Haitian government as well as Haitian associations so that we have sort of a direct link. So if you get a medical message in, then you know to direct that to the Ministry of Health. The problem is they're still trying to get themselves put back together still. So I believe there's the solutions team actually is meeting with the Ministry of Interior this week to continue that process and how to link the government into these sorts of systems a little bit more. So it's a work in progress.
Let me just jump in here for a minute on a question that is a corollary to this one. And that is, you guys are from a university environment, which kind of allowed you to have the resources at hand to jump in and put this together, university or nonprofit. And while the Haitian people has been the users of the system and the police and so forth will be continued users, what would be the mechanism, you think, to connect you to Haitian universities on the ground, Haitian technical professionals, so that we can help transfer that knowledge that enabled you to put the system in place, so that at the next crisis, there will be Haitians on the ground with the technical skill set to be able to ramp these up. They might still reach out to you, but how do we enable you to help transfer some of that infrastructure and knowledge to them?
Yeah, so actually initially we were working with Haitian engineers on the ground, so within the telcos. So the people at Digicel and then Comcel Walla were just amazing with engaging us in the whole time and establishing the 4636 short code and making sure that we got these messages. And in addition, when we initially got the messages from Digicel, it was also a local company, DigiPoint, who previously owned the 4636 code, and they immediately made that available and created a stream of these messages for us. I don't have an answer to how we can engage with the Haitian universities going forward, but I think that is a very good question.
That may have to be your long-term action that various of us volunteer for in the room to make that happen. I don't mean on the wireless side, but what you guys did. There are others in Haiti who would be enthusiastic and jumping up and down to do it. They might not have the resources. How do we empower them so that when there's a next hurricane or an earthquake, so that they can be your men on the ground with the translators already there who know the GIS, who can jump in and be a parallel, an auxiliary of what you're doing. That's part of the path forward.
You can talk about the training in Mirabelais.
Okay. Yeah. Actually, I just got back from Haiti. I was there for 2 weeks, and I went and trained the Samasource Computer Center on how to use Ushahidi and OpenStreetMap. So that's definitely one thing we're trying to think of, as many avenues as we can. How do we train people on the ground to use these tools that all of us know how to use as well? So I mean, that's definitely where we're looking at it. We'd love to do more trainings with university students. We're also working with an organization, Inurid, which is based in Cite Soleil. And we're trying to train them. We actually did a training last month on how to use GPS units. So, you know, we're trying to continuously go out there and build capacity on the ground.
Guys, we have about 10 more minutes and a lot of questions, so Pablo.
Hey there, Pablo from Google. It was great working with you guys on the missing person reports, first and final, first of all, thanks. And I think what you've done so far is great. We're in a crisis response group at Google. It's kind of getting up to speed, and we worked with you on early on. I want to know what we can do to provide better platforms for you and services, enhance the work that you're doing. And maybe I can see that a little bit by asking maybe Robert what you think about the automated translation that we have for Creole, and if we should be doing something more with that, or should we be testing that with you guys? And then also, if you guys can talk maybe about for SMS, we had a conversation early about maybe we should have a non-emergency number for the SMS and try to engage some more automated systems. And you know, are we at that point? Is that a good idea, or any other way that we could help get common platform and technology that would assist you?
Okay, so that's a great question about automation. So actually, we have been looking into ways to automate the translation, but that's been with Microsoft, not Google. I'm sure we could share the messages with you as well. So there's a team at Microsoft Research who were taking the messages from Ushahidi from very early on, and then we arranged a more formal connection with them. And so they take all the messages. They actually had to retranslate them offline. So just the nature of the technology, they needed better translations than what were made on the fly. And they've actually built that into the machine translation systems. And something that is a possibility going forward is then to connect, at least as a first pass, the machine translations. So so absolutely, like if you're still working on that technology, that'd be very useful. And we can absolutely make these translations, the parallel corpus, available to you to improve your own system.
I see Al waiting over here.
Go ahead, Al.
Really quickly, sorry.
Al, please. Oh,
I mean, if you have to answer the question, go ahead.
Good answer, really.
my bad, Josh. Go for it.
Really fast. So, quick message from Partners in Health. They would love to see Google Docs for low bandwidth settings. They were doing a lot of sharing via spreadsheets. It was a great collaboration tool, but tough to access at times. Regarding SMS, I think there's a big opportunity to use sort of more structured SMS with field staff or NGOs. The number of NGOs and professionals that flocked to Haiti that needed to be coordinating. That's where you can use the hashtags for meta tags, and that's where you can do different types of reporting with comma delimited or space delimited format. It's harder to do that and to engage the general population, but would love to talk to you more about that. Thanks, Al.
Al.
Thanks, Al Leon. My question is specific to some of the thoughts earlier about how do you codify this knowledge such that not only it could be used continually, in Haiti, but knowing what happened just recently, just after the Haiti earthquake in Chile, et cetera, how do you really create the protocol such that, independent of any one of us in this room, this could continue?
That is a good question. The several parts to that, I think. One is this was largely, there was a big volunteer effort that kind of came together and came around this service. And so I think one thing is familiarizing those who may volunteer with standard protocols for response. The United Nations has a response for going United States domestically and externally as well, so that we're not that we did, but so that in the future we don't butt heads with systems and that people can integrate more effectively and more smoothly. In terms of the technology, I think one thing, and conversations have started to percolate up, creating I'll call it a code of conduct, code of operations for people who want to participate, because when you have a kind of a top-down or hierarchical system for disaster response with unified command or something like that, how do you integrate volunteers with text messages? And how do we work in an environment that's beneficial? And so I think that's the first step. And then from there we could get to when people do volunteer or spring up, or we get translators or mappers, and how do they fit into that system?
So I think there's huge interest in replicating the system, but we also don't want to force the technology just for the tech's sake. So Chile, there were 3 functioning shortcodes for different types of emergencies, and the government was ready to respond to every one of those calls. They had call centers that were already stood up. So it wouldn't make sense to force a new shortcode directly after that earthquake. But certainly there will be cases where the system's needed, and so what we're trying to do now is really dig into this case study, this story, pull out best practices, pull out PDF how-tos, and pull together a knowledge base that can be transferred.
Hi, Timothy Large from Thomson Reuters Foundation. Thank you for your really interesting presentations. I was in Haiti about 2 days after the earthquake, and we used the 4636 platform to disseminate emergency information out to the people who were subscribed. And I remember going around to the radio stations a few days after the quake, helping to broadcast the information about how people could sign up to this service and use it. And I remember being really quite aware of the tremendous expectation that we were setting in people's minds, that if they had this 4636 thing in their pocket, that they could text their needs in and expect to get help. And that is a tremendous responsibility and an expectation. And I was very interested to hear Rob's statistic that 40,000, if I heard it right, 40,000 useful messages actually resulted in useful help being delivered to those people, which is truly remarkable and wonderful. But it does make me wonder about how scalable this type of sort of retail emergency response is, and is there a danger that we're creating a kind of two-tier system whereby those with the technology in their pockets or who happen to hear it receive the help, whereas the many others, and I remember being on the ground seeing that everybody needed food, everybody needed water. You know, if you were lucky enough to text it in and you got the help, is there a danger there? I just wanted to raise that because it was something I was quite aware about at the time.
So that's a very good question, and this is something we were quite conscious of very early on. Even right down to what auto reply somebody got when they sent a message to 4636. So we simply said message received. We always made it clear that it's not the case that help was on its way. In terms of the ability to respond, I want to say it was on maybe about day 6 or 7 that the responders actually came to us and said, we can take more volume, we can respond to every actionable message. In terms of the case of the people who send these messages get advantaged over the ones who don't send them, we're not in the position to make the call. So we give this information to the responders, and then it's up to them to decide how they best respond. Certainly, the American military are in a very good position to make these targeted responses. And we saw some of the greatest responses in fairly remote areas that they had the resources to access very quickly. Whereas organizations like the Red Cross aren't really set up to do this targeted emergency response, nor should they be. They're more about building the infrastructure and distribution points. So I think it's also a case of what responders we need to tie into. I mean, certainly Red Cross, we're using the Haiti maps to understand the distribution of needs and available services. But I would actually be very interested to find out more from the responders about how they use this information and how they decided what to respond to. And we simply haven't had the opportunity yet to sit down with them and work this out because they're still working so hard.
Yeah. And apart from word of mouth or paper reports, SMS really was the lowest common denominator. And you look at penetration rates and how they relate to access rates. 30% of the population has a cell phone in their hands. A very large percentage, 75 to 80%, is going to have access because of the community structures. So a lot of the messages were actually from bystanders and not the afflicted themselves, if that makes sense.
We've almost run out of time. I'm going to take one last question over here, Gilles.
Hello, thank you. This is Gilles Charleston, and I'm an earthquake survivor. I was there as well, and I appreciate all the help you guys were doing from remotely and as present on the ground as well. I think my question would probably be more echoing some of the pieces that have been said here. It's about empowering Haiti for the next disaster. We know there will be one. I've heard volunteers with Same as Source, which is very good. I think my concern is more of the active involvement, concrete involvement on the ground with the government. I've heard about the police, that is good. But also there is the FEMA equivalent, which is the Directorate of Civil Protection, for instance, in Haiti. How much involvement is being done with helping them having such a system that can help them respond or coordinate messages to people in zones or regions that will be affected, for example, for the next hurricane. Also, have there been a postmortem session with elements of the government, the authorities that are responsible and should be actively involved in preparing for the next emergencies in Haiti? And my last part is really about the SMS service from Digicel and Voila. I know the first couple of weeks or months after the quake, the phone service wasn't working, but I wasn't sure, was the SMS still working? Because I know I didn't try because I wasn't able to call, so I just didn't try. That's what I wanted to confirm with you.
Yeah, about 70% of the towers were working immediately, and SMS was getting through in the wake of the earthquake, which is partially what motivated this system.
And we really are engaging the government sort of across the board. And very early on, we started to receive content from the Ministry of Health that was going out through the EIS service so that people could see that this message and this suggestion to wash their hands or to different water filtration methods was coming from their government. So it built confidence, and rightly so. And we met with the close advisors to the president, and they're very interested in the system. Their capacity just wasn't there at the outset, but is building now. And that's what we're focusing on moving forward with the Ministry of Interior and their communications program.
Guys, could I suggest, we knew this would be an extremely popular panel. You can see the line of questions we have here. We're going to take one more question before we move to the next panel, but let me add that there will be a break shortly, and you'll be able to talk to all of these awesome dudes more one-on-one. So last question.
Hi, I'm Anders Bjornsson with Invenio. We worked in collaboration with NetHope to rapid deploy internet access to 8 organizations in Port-au-Prince immediately after the quake. And now as we move into the second phase, trying to make reliable internet access available in the rural areas in collaboration with the Haitian ISPs, Multilink and Access Haiti, is there a framework in place to take advantage of some of your geolocation knowledge, your experts who are familiar with areas, who are able to refine, use both location language and their knowledge of the areas to refine vague locations to specific locations to, some of the digital work efforts you have. So if I say, I have 20 locations, I'd like to work with you to get these 2 points on a map. Is there a framework in place to support that?
With that, I would suggest plugging into the OpenStreetMap team a little bit more. They've done a lot of work. They also sent a couple of their team to Haiti to do more sort of mapping work and put a lot more places on the map. So I would say reach out to OpenStreetMap.
I guess I meant a little bit more. I have a very vague location. Somebody says it's this place by this place by this place, rather than the intersection of defined street name or the intersection of a known address. So somebody, where your people were able to do the refining and the saying, oh, I know this place like my pocket. It seems like a huge pool of knowledge.
Well, I would suggest tying into Samasource and paying them to do that micro work, because they are Haitians that are very familiar with those streets and those locations, just like the volunteers that Rob and Roz were working with.
Over to Carlene then for closing comments, and we'll move to the next one.
Thank you, everyone. The conversation is certainly stimulating, and I look forward to being able to continue it with each of you. It is critical for us that as we move forward, that Haitians in Haiti become not only users of the system, but that we help find the right connections to transfer knowledge to those who are there in Haiti and Haitians American here who are eager to help to bridge that knowledge transfer so that they have that infrastructure for the next disaster, so that next disaster, there's a call center in Haiti that has a handshake with you. Thank you very much. Help me thank our panel.
Hi, I'm Caitlin Klavorik. I work with Cheryl Mills, who last March was asked by Secretary to be her point person on Haiti. And I don't think that she could ever imagine what that meant over the past 4.5 months. So on behalf of Cheryl and the Secretary and everyone else here, thank you so much for everything you've been doing and your interest, and we have a long way to go. Some of you were asking about capacity of the government of Haiti and how we can help. I'd be glad to discuss that with you at any point in time. Feel free to get in touch with me because there's a lot of ongoing work. But right now we're going to talk about the safe environment for women and girls. And before I invite Emily up to the stage, I just want to open it up because I feel I have a duty to Milan Verveer to do this, that no matter what happens, women and girls play an incredible role in how we respond. The multiplier effect for accessing women and girls and empowering them is tremendous. And there's this is something the Secretary likes to say, there's an old development proverb: if you give a man a fish, he eats for a day. If you teach a man to fish, he eats for a lifetime. But her twist on it is, if you teach a woman to fish, she feeds her whole village. So with that, I'd like to hand it over to Emily.
Thank you. So I'm Emily Jacoby. I'm from Digital Democracy. I was recently in Haiti with my colleague Abby Goldberg, who's our specialist on gender and Latin America. And it's really, she's actually the reason that we went down. We were in Haiti for only a week, but we were there to look at the situation for Haitian women and how technology could be harnessed to really protect them against an increasing onset of gender-based violence. So in order to do that and understand the situation, we wanted to really get to know the Haitian women that we were working with in Port-au-Prince. So we did a photography training, something we do quite often. And we worked with these women, 13 women, over the course of a few days and spent a lot of time getting to know them. We started by handing them flip cameras and asking them to interview each other about what words they associate with Haitian women. That's where the title of my talk came from. They use words like strength, courage, that they know misery, but also know how to survive, and that they know how to fight. So we looked at photography to start off with. They really were moved by this photo from National Geographic, very famous. And then this photo over here, which commemorated the UN head of mission who was killed during the earthquake. While I was showing that photo, this woman passed this photo up to the front to me. It's a photo of her daughter who died in the earthquake. She asked me to take this portrait later to really do her own commemoration of her daughter. So we moved into documentation phase. After just a few hours learning basic photography, they really went out and documented their homes, their communities, the camps and neighborhoods that they were living in. And I really wanted to use this opportunity to share their photos with you because their photos describe the problems that they're seeing in their community. I'll begin with shelter. Obviously, a major issue leads to a lot of other problems in the community. The UN estimates around 1,400 camps inside Port-au-Prince. Leads to other problems like waiting in line for water, queues a lot of time. They took a lot of photos of the problems related to this. We all know the problems associated in terms of waterborne illnesses and other things, long lines for the latrines. Took a lot of images of their fellow sisters cooking food in the camps, of themselves cooking food, preparing food for their families. And then unemployment, it's a major problem. And when we did interviews with them and asked them about the needs that they have, they talked a lot about microfinance because they don't have enough money. For women, it's worse. And because women head 48% of households in the country, they really need support. This was a picture that they had posed and clearly had spent a lot of time really thinking about the message they wanted to convey. I thought it was a pretty good way to talk about discrimination, exploitation, and abuse, which is happening inside the camps. INURED, which Roz mentioned, has done research in Cité Soleil about how young women in particular are forced to negotiate for food, for shelter. Violence in the camps is rising. Well, it has been since the earthquake. The shelter situation has led to a lot of rapes. There's a flip side, of course, and that is the strength of their family connections. I took a lot of photos of their families. We were especially moved by this photo of one of the photographer's daughters with her reading book, and the love that was there was really evident. This was an amazing event that we were able to experience. It was the meeting of Favi Lek, about 100 women in his space. Their office had actually been destroyed in the earthquake, so they were using a fellow group space. And we learned a lot about communications while we were there and the ways in which the women are staying organized and working with one another. As mentioned, cell phones about 30% across the country. In Port-au-Prince, that's actually much higher, and the women told us that everyone has a cell phone. And then we saw numbers that kind of back that up. This is from a survey done by Internews in neighborhoods in Port-au-Prince that showed not only that 83% of men had it, but 67% of women surveyed had access. Now, this photo, I don't know if you can tell, but those signposts are all empty, and I think that's sometimes how Haitians feel about the international community. They know they're there, but they don't really know what's going on, and the cluster system is working really hard to protect women and girls, but people don't always know how to access that. The tech response to Haiti has obviously been enormous and has achieved a lot of really significant results, but the women themselves don't always know how to access it. They're often denied access to it. The illiteracy levels of 43%, many of the women we worked with are illiterate, means that they can't even access the simple SMS messages systems that we just were talking about. So I really just want to close by saying that these are amazing women who are doing incredible things. They know how to organize, they know how to move their communities. And so figuring out how the technology can help support them is really our goal and what we want to talk about further. So I'm going to invite my colleague Abby up to stage to give some further context to the situation for women and girls.
No, it's just informal part of the discussion.
Cool. Open for questions or comments. Please, Carlene.
This is actually a topic that I'm even more passionate about than technology, and that is how do we, in this tragedy, find a way to help women and girls? I have two questions, thoughts that I want to put out there. One is there is the rise in violence. How do we tie that back into what the first panel was doing and perhaps distribute free cell phones to those women that are equipped with emergency alert systems where she can push a button and a message gets transmitted to 10 pre-programmed people who are there to come to her help. We all know the tragedy that happened even here recently with the University of Virginia tragedy when she was trying to call somebody. We have to assume that the victim can't talk, and maybe all they can do is push one button, and how do we make her secure? That's the first challenge I'd like to put out. The second one is, and this is my pet peeve, my friends in the audience know this, beyond just the violence, I keep thinking about the following. Haiti is a country that is overpopulated, and maybe something's being done there, and I'm not plugged into that part of it, but we have a large population of people who are very young. Half of the population is under 18, and who have been emotionally traumatized. They will seek one another for comfort. What are we doing so that 9 months from now, we don't have an overflow of young children who are born because in our human need, we reached out for comfort, but didn't take the necessary precautions? What is the birth control campaign that is being put out to help not add more young children to the misery?
Okay. Well, I'm going to just step back a little bit to answer that question. Haiti has by far, can you guys hear me? Haiti has by far the lowest representation of women in government in the hemisphere. There are about 4% women in the parliament, and they really lack access to leadership. So while the women that we were working with are from community-based organizations that are actually very well organized, but I think very hard for the humanitarian and international community to access, and vice versa. So I think that there's an enormous amount of legal discrimination within the Haitian system. There's different ages for marriage, for example. So women, the age for legal marriage for women is 15, while for men it's 18. Women start having babies much younger. There are some religious factors involved in this question that you're asking. Birth control, certainly abortion, and some of those issues are very much not talked about. And from our conversations, it wasn't really a welcome topic. So I think that this is more a larger question about women's status in society overall, and education and empowerment. And part of the reason that we're really interested, or that we've become interested in working with the women, is because this is really an opportunity for structural change all over the world in places where in conflict and post-conflict situations when the international community is very invested, it has been times when there have been massive changes in power structures and societies, and where women can move from 4% to 30%, which is required pretty much by international law, and most modern constitutions now have quotas that include that for women. So how can the international community help to support women in that effort? And I think that's one of the questions that we really need to be focusing more on.
And to that point, I will say that through the UN OCHA system, which is the emergency humanitarian response that the UN has, they did and they have identified different clusters. I didn't name it that. It's not named to reflect how they act. But there's across is a gender component. So they do understand that that's one of the things that needs to feed into absolutely everything that they do. And so building off of that question, I think I have a question which I want to try and see how we can marry this panel to the powers of the first panel, because the power of image and speech is incredible in Haiti. They have a very rich oral tradition, and there is a high illiteracy rate. So how do you think that we can better engage women, men, children, but especially women and girls through images and verbal communication in a way that breaks down barriers in asking for help?
Yeah, so that's a great question. It feeds very well off of what I wanted to add to Carlene's question, which is about the cell phones that could be used, as an emergency response. Because of the illiteracy rate of 43% among women, I think voice is a really important component, as well as really community representatives and finding point people, in every area who can really be resources and who have a working understanding of the knowledge. The UN system has been really trying to catalog all of that, and they have a whole listing of places where women can go. The problem is that without that being streamlined, it creates, there's a lot of confusion. Right now, the UN system is really just trying to check up on which places actually offer the services they say they will. In terms of images and voice, I totally agree that I think both are really powerful. We even talked a little bit with some women about starting to do more plays or kind of skits in the camps that could address the issue of birth control. And I think there's a lot of potential for that. There's a lot of creative energy that can be harnessed in the communities. And so again, it's really about working, I think, directly with the women's groups who are very much concerned about these issues and have weekly meetings about them to help them understand how they can scale up their capacity. Yeah, that's my initial.
Question right here.
Yeah, hi, my name is Chris Beatty. I'm a consultant for Conswell Walla, which is actually the #2 mobile subscriber. We have about 1 million subscribers. They just almost 2 million. We're the #1 U.S. investor. I've invested about over 200 million in the past 10 years. I've been there for 10 years. And both panels have suggested that cell phones are a very important component of development. We think the private sector can really be an important component of the development going forward. So I just wanted to let you guys know that we're here. Talk to me afterwards if you have suggestions for what Walla can be doing better, how we can help support these great initiatives. Let me know.
Luke.
So one question I have, I'll do this. One question, tying women in the environment and looking at environmental sustainability, looking at the environmental state of Haiti right now. And the question of, can we rebuild better? Can we build sustainability and create ecosystems that are balanced again? And how can we start to get that tie between women and the environment and just to improve? And then the second piece, incorporating women, innovation, technology. We've seen that in many places around the world, whether you call it an innovation lab, whether you call it an innovation space, but looking to find that link. So there's the empowerment, there's the training, the education, and what can we do with that? And did you guys, when you were there, did you see any of that? Was that was that an issue? Is that starting to develop? What?
Okay. Let's see. Well, I think, sorry. Let's see. I think that one major issue is a lack of resources for the women. And going back to what Katie said at the very beginning of the introduction of this panel about the post-disaster needs assessment and some of the findings, women were pretty left out of that process. So I think that in many cases, they are, a lot of times women are working on environmental issues. Technology, not so much yet. I think that there's a lot of interest, but the biggest problem is resources and people actually getting to them. They had very few. They haven't been invited to the UN meetings that are discussing these questions of innovation. And actually, in our experience, we went to one meeting held by one of the cluster groups, and the one representative who had come from inside the camps couldn't get into the meeting until the last half hour because he was held up at the gate. So I think there's some real problems with integrating the humanitarian community really with the grassroots level, which is the strongest and the ones really responding to many of these questions.
And let me just take 1 second to go back to your first question on the environment, which is one of the areas that the U.S. is looking and has been in discussions with the government of Haiti and other donors so that we can align our contributions and really help Haiti rather than go about what we typically have done and not work together, in essence, or as well as we could. One of the things is that we're looking at Lpg stoves. And the point of the Lpg stoves would be that we need to reduce the amount of charcoal that is used. Deforestation in Haiti is a tremendous problem. I think 3% of the land is not deforested, so 97% deforestation. And that's really where the women, that's one of the places that the women are going to be an extraordinary resource. So to that point, we are looking, we as the U.S. government are looking actively at that and understand the importance of marrying the environment with how we move forward in sustainable development.
Question right here.
Yes. My name is René Aubour. I would like to make 2 comments. One is with respect to what you said about women, and I agree with you, in Haiti. It's a country of paradox. On the one hand, women have very low representation in government, but at the same time, it's one of the few countries in the Caribbean where women have been elected both at president, and also there have been women who are prime ministers. Now, with respect to empowering women and using technology, one of the limitations that I see is that women tend to be the group in the population that has the least access to education. And for example, at NULA, and if you look at the call center 177, it has received already more than 10,000 calls since the earthquake. But the interesting thing is that the majority of the call, about 70%, come from women. So that's one of the problems that I see with the use of SMS. Haiti is a very illiterate country, and therefore it's easier for people to take a phone and call, because at least they can identify the numbers and call. And typically that's what we have seen happening at the level of the call center. I apologize that I have to be the one intervening, because my colleagues at Solutions, they have to meet with the Haitian government. As one of your panelists said earlier, they are in the process of negotiating with the government, so that the goal of NULA is, in fact, what we are trying to do is to pass the whole thing now to the government, so that we can move on to other things.
I think that's an excellent point, and it very much hits upon Luke's question as well about innovation. And I mean, our photo training, and granted, I don't think photo trainings are going to solve all the problems for Haitian women, obviously, but our photo training really showed that when women are given a chance to learn a new skill, they're very excited about it. Many of them had most of them had only taken pictures before, just simply being handed somebody else's camera and doing a simple point and click. And they talked about how empowering it was to learn how to actually frame a photo and what are the mechanics of a really basic digital camera. And so I think, given the interest that women have, obviously seriously in helping to build their society back by training them, by sparking innovation, by having an innovation space is a really powerful idea that I think can go a long way. We weren't able to visit the Samasource Center in Mirablet, but I think that projects like that are really, really imperative.
Please.
My name is Colin, and I'm a Haitian woman. And the Haitian girls and women is a very, very emotional, personal problem for me. I went to Haiti right after the quake to help some young women. What I found is that how do you solve a local problem when it's also an international problem? There are a lot of international organizations, NGOs in Haiti, and they are also, and I want to thank everybody who are involved in Haiti helping right now. But there is something we can do. We can monitor the international community, monitor the NGOs in Haiti. Anybody can open an orphanage, anybody can open an NGO, and they have girls and children in a gated community. And we don't have a social service monitoring those children, monitoring those girls. We can require the NGOs to register. If we have a sex offender, they are in the system. We can inform the Haitian government about that particular person so that they can intervene when something like that happening. There is a huge number of prostitution in Haiti lately. Why? Because of the economical situation. How do you advise someone that you're not supposed to do that? They don't have birth control. They are not protected against HIV. But if somebody is stepping in Haiti with a few US dollars, you can have access to a young woman and a man and young men. How can we put this system in place from the international community? The moment that they step in the airport, we know who they are, what they are doing, and we have people monitoring them all the time. If we solve it from before they step in Haiti, then we can start working on solving the problem in Haiti. The population is about 10 million. If we do not monitor the NGOs in the international community, and I'm saying it's not a huge number of them, but there are a few number of them that are stepping in the country, and they are not really helping those women and young girls. How do you take care of that problem?
I'll start answering that. Well, part of what we were doing in Haiti as well during the week was meeting with a number of UN agencies that are working on the development of a mechanism for reporting this kind of abuse, as well as gender-based violence and child protection. And that was the meeting I was referring to earlier, where there wasn't really any Haitian representation. And when you are talking about issues of sexual abuse and gender-based violence, these are very taboo, difficult issues to address. You know, in Haiti, one person we met with, a young Haitian woman, said that in Haiti it's still basically understood as the woman's fault if she's raped. And so this is where it is so important to be closely in touch with the community that you're trying to serve and understanding the way that they work, because a mechanism can't be put in place to report these kinds of abuses and to try and address them if it's not locally informed, particularly around such sensitive issues as this one.
And I'd just like to add, you know, we are welcome any ideas you have. Public information in Haiti and getting proper information to cut through the noise is a problem. And it is anytime there's a disaster, but especially here. So if anyone here has suggestions about how to do that, please come up to me. The other thing I want to say is I think we've been talking a lot about women and girls and the issues that pertain to them, but we haven't yet acknowledged that the men play a crucial role in this. And they too can help make sure that these problems do not continue on or do not perpetuate. So I just want to make sure that even though the panel is about what happens with women and girls, that doesn't mean that only women and girls play a role. So I think there's a question over here.
We got time for about one more, and Alyssa's up.
Hi, Alyssa Wright from OpenGeo. This actually segues what you were saying. I might be naive, but if you could speak briefly about why this violence is happening, and if besides empowering women, if there's anything going on to educate the men in these situations. I'm assuming that the violence is men against women. That actually could be a wrong assumption, but this seems to be a cultural problem that crosses gender.
Well, first of all, there's a history of rape being used for political violence, as part of political violence in Haiti. So actually, a lot of the women that we worked with were survivors of politically motivated rapes in the 1990s during the various coups. And so that's part of the context. And they have actually been working to fight against it and raise awareness for a long time. Why it's happening right now, as I kind of showed in terms of the shelter, when you have people living in camps, one of the problems is that sometimes different families are put together in the same camp, same tents. There's a lot of insecurity. A lot of reports that have been written, particularly in Cité Soleil, one of the slum areas of Port-au-Prince, have shown that in places where there aren't police presence, which is many places, there's lots of violence that happens at night. The point about men is absolutely valid. We met a lot of men who, before we even talked to them about why we were there, they actually listed that as one of the problems. I mean, they have their own family members who are being hurt and victimized, and so there are lots of men working to change the situation as well. But we have an overall, situation of instability that's leading to, increased violence.
Just to briefly add on to that, one of the things that I think is really important in addressing that issue is involving women in the design of these camps. A lot of women are attacked because latrines are far away, or because of various design issues in the camp that could make it much safer for them. So I think that's one very simple solution to helping to address that problem.
Emily?
And if I could just actually ask if Ashika could speak. I believe this is
course.
Ashika from Survivors Connect, and she actually knows much more about the situation of protecting children, so I'd like to have her have a word.
Can you guys hear me okay? Yeah. Okay. My name is Ashika, and I'm with Survivors Connect. I'm the founder and executive director, and I've been working in Haiti for the past month, and we'll be going back on Saturday to continue this work. So what we've been doing, I'm actually part of a larger coalition of organizations based in the U.S. as well as in Haiti to address modern-day slavery and human trafficking. But we understand that trafficking it's a process. It's not something that can be identified in an isolated incident. It's usually something that's at the end game when someone's been trafficked, that's what you know what it is. But the bigger issue we're dealing with is violence in the camps. And so what we wanted to do was create a really localized process that NGOs, all Haitian NGOs were using to basically address these issues in the camp. So what I'm doing is working with local partners, a couple which some of you may know, Fundación Espoir and FNJD. And these are two NGOs, completely all Haitian-led, and what we're doing is we've created an SMS system. We're using Frontline SMS, and we're hoping to integrate into Ushahidi pretty soon. But basically what we've done is we're creating a helpline system where individual camps, we are working with just 40 camps right now, which are home to about 160,000 people. And we are going to these communities, or the tent cities, to raise awareness about human trafficking, about violence against women more broadly, and giving them our helpline so that they can text in instances of violence, abuse against children, missing persons, etc. And the reason why we've done this is that the number that we're providing is something that's personal, and we put a face behind it to say that when we go into these communities and give the number, we say, hey, this is the person that you're contacting, and we can provide help and support. One of the comments you guys made earlier, which I think is dead on, is that you have all these UN agencies and the clusters developing all these different hotlines. There's about 15 that I've counted so far for the following topics: human trafficking, gender-based violence, missing children's reporting, etc. you can't expect the average citizen to navigate all of these hotlines. No one's going to call them. And so what we've done is we're also using this SMS system as a referral network because our trained volunteers in the back end know what all these hotlines are about, so then when they do get a text, they can actually refer them to the proper agency or person, or they can handle the case themselves. So if you guys want to know more details, you can talk to me later, but I just wanted to put that example out there. And again, this is also using all local talent and energies, and I think that's what's going to make it sustainable in the long run.
Thank you. Caitlin, do you want to give us some closing words?
Yes. Well, first, I just wanted to thank you guys for coming up here and for doing all the work that you did in Haiti. I think that just like it's a cross-cutting issue across UN clusters, women and girls, and the role gender plays writ large is a cross-cutting issue again, along every panel that we're going to have today. So I encourage that you keep an open line of communication with us. And in the spirit of this being a panel about empowering women and girls, I just wanted to give a quick recognition to 3 women of the State Department who've done an incredible amount both today and in the days after, hours and days after the earthquake: Katie Dowd, Katie Stanton, and Suzanne Hall. So they all deserve a round of applause. Thanks.
Guys, thank you so much. I think we've heard from a couple of tremendous panels this morning. We really appreciate all of the input from the audience. You are now free for about 30 minutes. No pressure, but make friends, make partners, do this networking thing. Coffee out there, and we'll be back here at 10:30 to talk tracking in a crisis. Thank you.